We've now put together the FPU with the cannula and the Taralock, and you've handed it to the surgeon. What do they do and how do they use it? So let me quickly show you how it works. So the first thing you need to do is obviously insert the cannula into the patient. So once the cannula is in the patient, the surgeon simply needs to pull back on the Taralock around halfway so that the piston is roughly halfway up the syringe, and that will create a negative pressure and enough of a negative pressure for him to start aspirating. So obviously the most important thing, make sure it is inserted into the patient before you pull it back, otherwise you're just going to be pulling back air. Now, once that's halfway, the surgeon can start aspirating, can start harvesting, and when it fills up to a certain amount and the surgeon notices that it's sort of slowed down, it's not harvesting as quickly as it used to be, then this is starting to fill up. So all you do is then obviously take it out of the patient, hold it up, push the button, and just push the piston up so that it gets rid of any air and any empty space. Push it all the way up till the fats and the tumescence, if used, is all the way at the top of the syringe. Then insert it back into the patient and then just pull back on the Taralock again till you're almost at the end, and depending on how full it is, sometimes you just pull it all the way to the end and continue. Okay, so this is how they do it. And again, if it's filling up but not quite full, then take it out again, hold it up, push the button, push the piston until you've gotten rid of all the air and empty space. All right, then just simply repeat that until you've got a full 50 ml of lipoaspirate, and the 50 ml should be measured at the very top of the piston. So when you look down into the piston, you'll see the top part is a little clear bit, and that should line up roughly at the 50 ml mark. So if you're a couple of mils below or over, that's okay. A couple of mils is not going to make a lot of difference. Now, you can also, of course, go all the way till the syringe is completely full, which gives you about 55 mils, okay? So it's 50 to 55 mils. 50 is pretty much full, but you can go to 55. And that is how you harvest one full syringe. So depending on how much fat the surgeon requires for re-injection, you will then determine how many syringes you will need and how much fat they'll need to harvest.